The human nervous system relies on electricity to function. Nerve cells use electricity and chemicals to communicate with one another, transmitting information like little messages throughout your body and brain. Your body depends on these electrical signals to do just about everything. From smiling to walking, processing memories or feelings, it all comes back to electrical signals in the brain. Beginning in the 1930s, physicians built on this knowledge, developing something known as the Montreal procedure to help treat epilepsy patients. This method used an electrical probe to directly stimulate different parts of a patient's cerebral cortex. After removing a section of a patient's skull, a physician would use it to electrically trigger different sections of the brain. While the patient was awake and providing feedback, the physician would use the probe to stimulate different sensations like flashing lights or smells that the patient could report. Epileptic patients sometimes experience auras before the onset of a seizure. And these auras might involve very particular sensations or perceptions, like the smell of burnt toast, for example. If a patient reported something similar to their seizure aura as a result of the electrical stimulation, the doctors knew they'd found the part of the brain causing seizures. And then they could remove or destroy a small section of tissue there. Freaky as it sounds, this often successfully reduced the patient's risk of seizures. And the Montreal procedure was also used to map out the brain, notably the sensory and motor cortices. By the second half of the 20th century, physicians were learning that certain types of electrical stimulation were especially useful in treating symptoms related to neurological movement disorders like Parkinson's disease. Though it's still not fully understood, it's believed that electrical stimulation affects the way nerve cells in the brain, called neurons, communicate